Hello, I'm Dr. Armand Farr. I want to talk to you about age-related macular degeneration. As the name implies, it has to do with aging, and it has become the #1 cause of vision loss in our older population in the U.S., and it affects millions of people in the U.S. and worldwide. Now, the key thing here is this vision loss. It's not blindness. I have almost daily people coming to me who've seen their regular eye doctor and even retina specialists come to me for a second opinion because they're so scared they think they're going to go totally blind. Now, you can lose vision from macular degeneration. It can be severe at times to the point of losing the ability to read or drive, but it's almost never a situation where you lose your ability to get around. You're not going to need a guide dog or a cane to get around. Now, let's talk about the two types of macular degeneration. There's dry or non-exudative, where some of the cells are lost and there's some deposits, and we'll show you a picture of that. And also the wet, which is more aggressive. So let's look at eye anatomy first. So here is a model of an eye, larger than actual size. Glasses will sit here. Now if you look inside, you got images come in, get focused by the cornea, which is a window to the eye, and the lens, which also focuses the images. That's the part that becomes cloudy and is called a cataract. Images then go to the retina, the thin film that lines the back of your eye. Kind of like a camera. You got a lens and the film. Now, the area where you have your best vision, and this model is marked with a yellow spot, is the macula. Images get focused there, and then they're transmitted to the brain via the optic nerve, and then the brain can interpret those images. Now, when your eye doctor or retina specialist looks at you, they use special instruments and lenses to look in the back of the eye, and this is what we see. You have the nerve here that connects to the brain, these blood vessels that bracket the macula. The macula is this area right in the middle, and right in the center of it is the fovea. So that's what normal looks like. Now, in someone who has dry macular degeneration, they have these little yellow deposits, maybe some pigmentary changes. These deposits are lipofuscin under the retina. There won't be a quiz afterward, but those things cause the next step, the wet macular degeneration. In and of themselves, some people have dry macular degeneration, have these deposits, they don't even know they have it. And what happens is sometimes you can still lose vision from dry macular degeneration. These little yellow deposits can coalesce and cause an area of atrophy where you lose vision. But the most common way folks with macular degeneration lose vision is with wet macular degeneration. So they progress from this to something like this. What happens in wet macular degeneration is abnormal blood vessels grow under the retina. They bleed and leak. You can see this blood under the retina, and that can cause a sudden change of vision. Sudden distortion to straight lines. You look at a telephone pole and it's wavy, or just simply loss of vision, or what we call a scotoma, where you look at it straight on and it looks like somebody's put their fist in front of your face and it's hard to see. So in this scenario, we treat with injections of special drugs into the eye. Sounds bad, people tolerate it very well. Unfortunately, it's not a cure, but it's a way to slow it down, and in some cases even reverse the vision loss. All round numbers, about 90% of folks can stabilize, and about 40% of the time we can improve the vision. Now, what can you do if you've been diagnosed with macular degeneration? First, stop smoking if you smoke. If you have high blood pressure, make sure it's under control. The other thing, the biggest news that came out for macular degeneration a few years ago was that through a National Eye Institute study, they found out that certain formula of vitamins can slow down macular degeneration. The study was called the Age-Related Eye Disease Study, or AREDS, A-R-E-D-S. And this is the type that we have in our office to provide our patients. AREDS 2 vitamins, AREDS 1 the formula was a little different. They changed it, they added zeaxanthin and lutein to the second one. I like this one because we know who makes it, how they make it is properly made, goes through the proper controls, and it's easy to swallow gel cap. But there are different brands out there. So those vitamins can help slow it down. So you should talk to your eye doctor and make sure it's appropriate for your type of macular degeneration. The other thing you can do is eat right. That sounds easy, and it can be, but there are dozens of studies, scientific studies, that have shown that diets rich in antioxidants, zeaxanthines, lutein, omega-3 can help slow down macular degeneration. So let's get out of the office and go to my kitchen. So welcome to my kitchen. I created Cook with Doc to help people with macular degeneration find recipes that have ingredients that help slow down this dreaded disease. So there's nothing funky to the recipe or the ingredients. It's basically a Mediterranean diet with certain foods rich in antioxidants added to it. These are delicious recipes that I prepare for my own family on a weekly basis. And it's all about, again, the ingredients. Things that are high in antioxidants, zeaxanthines, such as spinach or kale, peppers with a nice color to them, berries, especially blueberries and raspberries, and fruits that are color rich like mangoes or things like sweet potatoes, and also fish like salmon and halibut that are rich in omega-3s. So check out cookwithdoc.com and enjoy cooking for your eyes. Thank you.